Expanding on the insightful conversation between Dr. Andrew Huberman and Dr. Natalie Crawford, the podcast delves into the intricate details of female reproductive health, highlighting not only the biological mechanisms, but also the influence of lifestyle factors and medical interventions on fertility and overall well-being. Dr. Crawford begins with a deep dive into the developmental stages of female puberty. She outlines the critical milestones, such as the development of breasts and the onset of menstruation, explaining their significance in the context of overall hormonal health and fertility. The discussion emphasizes that the timing of puberty, while crucial for developmental milestones, does not directly correlate with the duration of a woman's fertility, debunking common myths about the early or late onset of puberty. The conversation then transitions to the menstrual cycle, dissecting its phases in detail. Dr. Crawford elucidates the roles of estrogen and progesterone during the follicular and luteal phases, highlighting how these hormones influence not only the physical aspects of the cycle, but also mood and behavior. This part of the discussion offers a clear understanding of how hormonal fluctuations can impact daily life, underlining the importance of menstrual regularity as an indicator of hormonal balance and health. The topic of contraception is explored comprehensively. Dr. Crawford provides clarity on various forms of birth control, particularly hormonal contraceptives like the pill. She explains that while these contraceptives don't deplete ovarian egg reserves, they can affect hormone levels indicative of fertility, such as AMH. This information is particularly pertinent for women considering future fertility treatments. The discussion also covers the mechanisms and effects of different IUDs, including the copper IUD and hormonal variants, offering listeners an in-depth understanding of their impact on menstrual cycles and fertility. A significant portion of the podcast is dedicated to discussing the impact of lifestyle choices on reproductive health. Dr. Crawford strongly cautions against the harmful impact of smoking, e-cigarette use, and using cannabis on the quality of both eggs and sperm. She discusses the potential for these substances to not only decrease fertility, but also increase the risk of miscarriage and affect the health of a future child. The discussion extends to alcohol consumption, where moderation is stressed as key to maintaining reproductive health. Moreover, the podcast delves into advanced reproductive technologies and treatments, such as IVF and egg freezing. Dr. Crawford explains these processes in layman's terms, demystifying the science behind them and offering hope to those facing fertility challenges. She also touches on the psychological aspects of fertility and the importance of mental health support for individuals and couples navigating these complex paths. In conclusion, the podcast presents a holistic view of female reproductive health, balancing scientific detail with practical advice. It offers a comprehensive resource for understanding the nuances of hormonal changes, fertility, and the impact of lifestyle choices. Dr. Huberman and Dr. Crawford succeed in making this complex topic accessible and informative, providing valuable knowledge for anyone interested in female health and fertility.